Youth suicide is on the rise in the United States, according to recently released federal data. This, as an investigation by Cosmopolitan magazine found mental health services on college campuses to be lacking. Tonight, we take a look at how these issues are being addressed by some colleges in this region. Licensed clinical social worker Sarah McIntyre of Springfield Technical Community College and Chris Evans of Smith College spoke with me, as well as Smith College senior Amelia Wendorski. They shared their perspectives with me in the studio.
Yes, at Smith we're following national trends, and what we know is from about 2010 on, we had about a 30 to 40% rise in demand for students for mental health services on campus, and we see that at Smith as well. So while this is a topic that I think is getting important attention right now, this is a trend we've seen for the past several years.
And how about for you, Sarah, at Springfield Technical Community College?
I think we have a unique added factor where we have non-traditional students who are a little bit older, and yes, it's definitely between the two, there's an increased need for services.
So you're seeing an increase, but maybe some of those older students might not be living on campus, or perhaps if they are seeking services, they might be seeking them off campus even.
Correct.
Yeah,
Correct.
So a bit of a mix there.
Yeah.
Amelia, for you, you're a senior at Smith College. Have you seen a need for mental health services on campus being talked about more? Students saying, you know, this is something I need to go and make use of.
Yeah, I think at Smith, a lot of my peers are very open about seeking mental health. I think we've done a lot of really great work around help seeking and around destigmatizing that process. And that has been a big conversation over the past few years.
I know that you're involved in a group called Active Minds, right? And that's a mental health advocacy organization.
Yeah, so we're a mental health advocacy and education organization by and for students. And we're working to kind of decrease the stigma around experiencing psychological distress and seeking help for mental health. And then we're also trying to do a lot of psychoeducation to help people understand the experiences they're going through, the experiences their friends are having, and what they can do to best support themselves and others.
There have been some statistics lately that have been reported out both by the PBS NewsHour and Cosmopolitan magazine did quite an extensive report on mental health on college campuses. And in that Cosmo piece, they quoted the Association for University and College Counseling Center Directors, big title, between 2010 and 2016, said that students' need on campus for counseling went up 30%, which you referenced, you know, that trend, seeing that, which is more than 5 times the growth of overall college enrollment. So how are college counseling centers keeping up with this demand?
Well, I think what you see nationally is people shifting from what has traditionally been a one-on-one approach, traditional psychotherapy, to taking a public health approach to mental health, which means increasing community connections on campus and also really attending to some of the stressors that are part of the broader culture that place some students disproportionately at risk for developing mental health difficulties.
What's one stressor you're talking about?
Well, one of the things we see at Smith is, we've seen a rise in enrollment in gender minority colleges, and oftentimes that's because it's a safer place for students to deal with mental health struggles and with some of the challenges that they face in society.
Another statistic that came out, I mentioned the PBS NewsHour, and they reported some national data from the National Center for Health Statistics and the Center for Disease Control that pointed out that suicide is the second leading cause of death among young Americans aged 15 to 24. Mm-hmm. When I heard that statistic, it just really kind of took my breath away. For you, dealing with students and counseling them, are you hearing the word suicide coming up more often?
Definitely. We're talking about it more, specifically in my classes. They're social work based classes. So I try to remove the stigma within the classroom setting. It has opened up communication with a lot of students coming to me with personal struggles, and if it's not their own personal struggle, it's somebody that's close to them that is. So it affects from all different ways.
And so then how are you helping them to deal with that if they come and they open up to you? Are you referring them to a counselor either on campus?
It's as simple as having a conversation and kind of, assessing where somebody's at, and then, referring to the appropriate resources. We do have River Valley Counseling on campus that sees our students, as well as the Health and Wellness Center.
One of the points in the Cosmopolitan article was that students may be breaking that trend where the stigma that we've seen for years and years around mental health is it's a struggle I deal with on my own, it's something I won't talk about, I'm ashamed to talk about. Students might be bridging that gap now, but then maybe hitting another barrier, which is access to care. Chris, how are you confronting that at Smith? Do you have enough counselors to meet the need?
Well, I think if we had more counselors, students would use more counselors, and our college has made a priority by hiring new clinicians this year. But I think that, we're always trying to partner with the students to find ways of reaching out to them that make sense. So we're providing 24-hour crisis intervention by phone. We're trying to increase resources available through the website, trying to work together with student organizations to find other ways of connecting, and then providing as much direct care as we can.
Amelia, I know that Active Minds had a recent campaign that really worked to reduce the stigma among the student population and raise awareness about seeking out mental health services. How was that campaign received? What did you hear from students?
I got a lot of really positive feedback from the interactive mental health display that we have up right now, and it encourages all Smith community members to reflect on the ways they seek support for their mental health, and then each individual can represent those ways and themselves in the display. And it's been really heartening to see all these people participating. I think we've had like hundreds showing how many people are seeking support for their mental health, and seeing that it is increasing a dialogue amongst the student body, and taking away the shame from things like going to therapy and taking medication for one's mental health.
Something else that this reporting brought up was the fact that students are reporting more often now feeling hopeless or helpless, and then those thoughts can in fact spiral and you become more dire feeling, and then you're considering possibly suicide. But do you talk with students, or do you have a sense of what's driving stress? What's making you, not maybe you specifically, but peers feel this stress, this anxiety?
I think there's a lot of pressures on college students right now, be it financial, be it political. There's a lot of complex political issues going on that target a lot of different identity groups. So I think there's just a plethora of issues facing college students. And in addition to that, mental health services have improved, so there are a lot more people who are entering college who maybe wouldn't have even graduated high school before and need more support that continues throughout their education.
Chris, you're nodding your head. Yeah, anything?
Yeah, I think, a lot of people are expressing concern about this rise, but I think the other thing that we are looking at in the literature is that one of the things that we say is we've asked folks to ask for help for years, and this is actually also a good sign that we're talking about it more openly, we're reducing the stigma, people don't have to suffer in silence anymore. And so, as much as we're concerned about this, we're also seeing this as something that's positive.
If someone is watching this and they or someone they know is expressing some of these feelings or these anxieties, what should they do? Where should they go first?
Have a conversation with somebody. It can be a friend, it can be, somebody that just have a conversation. Start talking about how you're feeling. It proves to help. So
there are national hotlines. There's a national suicide hotline. There are also a range of hotlines that support students and individuals with a range of identities. There's 7 Cups of Tea is a wonderful resource. And I think the important thing to keep in mind is that talking about it does not increase the risk. That it's 100% reduces the risk. So important to just reach out, find somebody with whom you can connect, and then connect with somebody, a professional support service.